Hello, welcome to the Friday webinar. We're on with Dr. Tom Tully. Hey, Dr. Tully, welcome.
Well, thank you, Laura, and it's good to see you and all of our participants on the webinar. And looking forward to another great Ask the Vet and see what's out there. See if we get a go along a topic line like we do from time to time. It's like we get a lot of
Right.
questions on the same, kind of in the same general area and. It always makes it interesting because I don't know, we've been doing a few of these over the last few years, and it always seems to be something new. Something new comes up,
Right.
and that's just kind of like what I do, and it's one of the most exciting things that every day is a new day. I learn something every day, and that's fun. That's fun, and
Yeah.
look forward to learning
Eh,
something now, with that. So you're doing well?
Yeah. So last episode, it was like a nail claw trim, a lot of claw
Yeah,
press,
exactly.
nails. So
Exactly. Yeah.
let's see what we get today. Yeah. So let's see if you're just joining us. Let us know where you're joining from, and if you want to give a weather update, go for it because weather is all over this time of year. It could be hot somewhere and raining other places. So
It's
yeah.
spring here. I mean, it's like 80 degrees, I think, today here. So,
Oh wow. Okay. All right.
yeah. So, you know, it's-
Yeah.
but
Great. Well,
anyway,
yeah.
getting ready for Thanksgiving, my favorite holiday. I love Thanksgiving. Not because
Yeah.
of eating, but that doesn't hurt.
Yeah.
But it's like it's on a Thursday. It's always on a Thursday, so you have really a 4 day,
Right.
weekend, and you don't really have to buy anything other than cook maybe a little bit, and you can just
Well, all the
enjoy
buying
and
happens
relax.
before. Yeah.
You
Yeah.
know, the calm before the storm, as they say.
That's right. That is right. Yeah. So maybe we have some Thanksgiving related questions today.
Yeah.
It's
Yeah.
all about probably about what the meals can be. That you could share. Well, maybe we'll ask that towards. So let's see. I think we had a start off question.
Let's see.
I am now going to find. Sorry. Bear with me. Okay, ready? This is
Sure.
about Kiwi, the 34-year-old Senegal parrot that began having difficulty stepping up in September. So the
Hmm.
problem seemed to be placing her foot in the right place on when she'd step up. So she would move it off and on several times before grabbing it as if she were not sure what was underfoot. She also
Hmm.
began to climb less around that time, though she was still able to walk without difficulty. So when the vet examiner found that Kiwi does not respond to sensory stimuli in her feet, so while she has motor function, she does not seem to feel deep pain in her toes or feet. Both of her legs were normal and felt deep pain. She said that she has seen parakeets with renal tumors who have trouble with the foot and leg on one side, but Kiwi's problem is bilateral and does not seem to affect her legs. So they're wondering what the imaging and other diagnostic tools you would recommend as next steps.
Yeah, that's a great question. The the first the first thing, we have a 34-year-old Senegal parrot. Um, that's old. Well, that's old. Um, but they teach us they teach in veterinary school that age isn't a disease. Age is not a disease, right? So it's not like, oh, well, we have to treat age. But, I kind of disagree with that a little bit. Um, it's not, just because they teach it doesn't mean it's always right. But I think that uh, just in reality, um, as you age, there are increased chances of developing um, disease conditions. And so you can look at it, and then that's it. Age may not be a disease, but age surely makes you more susceptible to different disease conditions. And so 34 years old, they've done a fantastic job with that little Senegal. I just hope my Senegal lives at least 34 years old. because we don't know how long this one is gonna, it could go for another 34 years. Well, that would be a Guinness Book of World Record, but nonetheless. So we have these issues with the feed. So what to recommend? As always, there should be a general baseline, as I had mentioned before, of knowing if it's never had any baseline blood work. Just like if you were, uh, I don't know, maybe a 50-year-old person, but it doesn't matter. You go in for an exam, they're going to want to know what's going on inside. And like I said, that's what blood does. I mean, we can look at them on the outside, but yeah, we don't know what's on the inside. And that gives us kind of a picture into the interior of the patient. So that would be something just to look at that because some of the different conditions that may be associated with it's hard to say because and it sounds like you have a great veterinarian, but some of the things you have to try to interpret because it's not like, you know, pinching and you look for a response to see if it has deep pain. So what, some people on the webinar may not, say, well, what do you mean deep pain? Well, when you're saying you say, well, there's superficial pain and there's deep pain. Well, if you don't have deep pain, you surely don't have superficial pain in most, and it can get more complex than that. But for the most part, you can have where it looks like it has no feeling, but if you pinch the toe, the bird responds. That's deep pain. Okay, that's what they're kind of classifying generally as deep pain. If you if you put a little bit more pressure on it and try to stimulate a response, that would be deep pain. And so I'm not really sure if it does. If it doesn't, there has to be some, neurologic activity in the leg because or feet because it can still perch. Okay, I don't think that it's like if it can't use the feet, it appears that it can. So, so there's just some type of a reduced ability or function in those feet, and it's obvious. 34-year old bird, and so the assessment see what's going on with the blood work because what you can have is you start looking at, well, what could cause this? And it's just like the veterinarian said, well, we've seen tumors that have affected and caused impingement on the nerve where the tumor gets so big it puts pressure on the nerve. It's kind of like when your leg goes to sleep, okay? Your leg goes to sleep. Well, what? Oh, wake up, leg, like it didn't doze off. What's causing that is kind of like it's pressure on a nerve that causes that kind of that to actually occur. And or and so this is the impingement, but the pressure never goes off. It keeps going. And so it's like it's a permanent, let's just say we're using it again generally that the legs are kind of, well, you can't use it because you can't feel it, okay, because there's pressure. That's a tumor doing that. Usually when we see it in budgies, and so that's more of the common bird that we see it. You have a budgie come in with one leg lame, but using the other. Most of the time, it's going to be a tumor causing that and but not both legs. The budgie doesn't come in on the bottom of the cage laying down with his legs. I can't use my legs. I can't use my legs. It's not saying that because it's usually just one, so it's perching on that. And so that's the veterinarian's correct on that. But it could be. You never rule out a tumor because that's a possibility. The other thing that you can look at is that we have an older. What about older people? You know, what happens when to the joints in older people? Arthritis. Sometimes, and when you have that inflammation. So, what is arthritis? Or arthritis. It's the articular inflammation. It's the joints. The joints are inflamed, the itis. And so you can have you have many different forms of arthritis, but that usually occurs more, in older as you age. And of course, you could contribute to it by abusing your joints in all many different types of ways. Athletics is one of them, but this can be what is just usage. Can this can be develop, and so if you have inflammation, and then that would possibly show up in the blood to try to kind of coincide with this. Now, Senegal, it's a smaller bird, what, 160 grams, somewhere in that area. And so if you're looking at that, those joints are small and the radiographic equipment's good, but I guess the best thing to do is look at, first of all, I would just take traditional radiographs, x-rays, just take some x-rays to see within the joints how the joints and bones look, but primarily the joints of the legs and the feet, and look at that. Now, of course, if there's nothing there, then there may be, and then depending on what the blood work shows, that if there's nothing that you can denote at that within the X-rays, then and you'd have to get an evaluation. So we're going step by step. Hopefully, with those first tests, boom, determine what it is. But but then you can go into getting a CT, a CAT scan, computed tomography, and get an imaging there and take slices. And then that's when you would be looking at the kidneys and you'd be looking at the body. And then last but not least, and you can put this anywhere in there, and you can even start with this at this point. Well, I would say at least get those preliminary test results because this would be helpful, is to get a neurologic exam by a neurologist and somebody that's comfortable. And they're not around. They're rarer than what you would with avian veterinarians. But at the same time, I know that we have a neurologist here that is fantastic, and there are other neurologists that veterinary neurologists that will look at birds, but that is also an option. But as far as a uh, practicable option, for most people, it isn't, but I have to put that out there because I want to encourage that by the veterinary community to have more neurologists that would be knowledgeable about birds and the most important part, they're knowledgeable about neurology, but really are the ones that will be enthusiastic about using their neurological expertise to evaluate a patient. So that's kind of the information, and it's kind of how it works up and what the possibilities are. But excellent first question. Thank you.
There we go. All right. I didn't know they had a specialty like that. That's amazing. So
Yeah. Oh, yeah. Oh, yes.
there's a lot of special. We'll
Uh,
have to do a thing on all the different specialties
yeah,
that.
neurologist. I
Yeah.
mean, and you don't want to even think about human physician. I mean, oh, I'm a hand specialist. I don't do any orthopedics except on the hand. I only do bones. We're not quite there.
We're getting there.
Uh,
All right. We have a question from Richard about how soon would someone take a chick in their to their first health screening for preventive care. So if you were to have a baby bird, little chick,
Hmm. Well, what I would say is if you're not having any difficulty, I would say after it's comfortably weaned and it's eating on its own, and it depends on depending a little bit later in macaws, a little bit earlier um, in say a cockatiel, and so. The one thing about that, that's a good question. Okay, when's the first time a young bird? It almost depends upon the because younger birds can definitely handle a physical exam and blood collection, testing if it's needed, and so it's if you just don't have any issues with it, then I would say to do that after it's comfortably weaned. I mean, I've seen birds that are 10 days old. And so and younger than that, have been involved in uh, with the treatment of birds for different various reasons. But that's usually when there were problems, okay? And just to give you an idea on what the range of birds, it doesn't matter age about being seen, but just to get information, getting a health check and just making sure kind of up to date on the latest information that's going to provide a quality care and management and nutrition for that young bird as it goes on so it can live a long life. And that's what you're looking for. And so there's no reason unless you have an issue, I would say, but I would say after it's weaned and comfortably and on that. Now, what's a variable here is if you buy a bird that's young, and I'd always recommend buying if you have absolutely no experience in hand feeding a bird unless you're very experienced at doing that, then I would not recommend buying a bird that's not weaned. But in any event, if it's weaned or not, you have the bird. It could be younger. You may have a specific time frame to get that bird checked, and I would recommend doing that. Just because of you bringing a new bird into the house. It may be a single bird. You may not have that much information on that species or what have you to get as much information and get an assessment of what you had before, or if there's anything that does happen.
okay.
Yeah, but
Question
good
about
question. Good question on that.
yes, question about kikes. So are kikes of any age susceptible to polyoma?
Um, I would say so. I would say so. I don't know why they would be specifically not susceptible to polyoma. And I'd have to uh, you know, verify that with Dr. Ritchie, but I don't think that they have any type of an immune system, um, you know, anything special in their immune system that would make them not susceptible to polyoma. Um, and so I would say so. And are they, and I think the question was at any age or something like that, or something like,
Yeah, yeah.
well, in polyoma, and I don't know if we've talked that much about polyoma even, but it's hard to remember all the way back. But in polyoma, in as far as the disease is concerned in parrots. Now, you can say budgies, polyomavirus is somewhat endemic, and that virus usually causes feather duster disease. So budgies can definitely be subclinical carriers of the virus, but not show clinical signs. And then they can also have birds and young that develop their feather duster disease, where they have dystrophic and abnormal growth of feathers. But that's the virus, and viruses morph and go through that, but we'll just talk about polyoma virus. That's the virus as it presents in budgies, and they can die from it, but then they can live for a period of time or even be, not show disease. In parrots, and it's a different story. Now, they can be subclinical carriers, meaning they can be infected, but not actually show the disease. Their immune system keeps everything, and for whatever the 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 polyoma, as far as their older birds can carry it and be subclinical carriers and not have any clinical disease signs. But the difference is that in larger birds, and this would include the kikes, that what you're looking at is the young when birds the most susceptible birds are those birds that are fledging out, that are getting their feathers in. And so that's looking before they're fully feathered. And so that is the most critical time when polyoma is I think most pathologic to the parrots. And so this is when it attacks the liver. They have problems with blood clotting because the liver's involved with blood clotting. And so that's why you have all of these bruises, this bruising and the inability to clot with polyomavirus in in the parrot type, in kikes or African grays or macaws or what have you, in that age range as they're putting on feathers, and when they to the fully fledged, that's the most critical time. We rarely see a parrot that is older that is that has the disease that's after it's weaned and out. We rarely see that. It can occur, but it's very rare. If polyoma is present and those birds are young in that age range that I said, it's highly likely. We call that morbidity and mortality. You can have the disease and not it may not kill the bird, but for those birds, we have high morbidity or disease and high mortality. If you have polyoma, if you're feeding young birds, and this is how it usually is, people get birds from here, and I'll get some birds from here, and you have a kind of a cafeteria thing going, and you have all these birds, and you're hand feeding all these baby birds. That's where the problems are. That's where the problems are with polyoma. And and we can probably identify it fairly quickly on that. So the kikes, I said, wouldn't be any different. It would be rare that you would have an older bird with it. They could have the disease, and then and it's the same age range that they would be the most susceptible. So you say, what about older birds? Well, the older birds, the problem comes with if they're subclinical carriers, and this is how it kind of perpetuates along the lines with actually having budgies that may spread it to younger birds too, and old, but it's in reproductive situations where people have pairs where older birds are a pair of birds and have young. Well, during that, when they have the virus and then they're not sick, well, they look perfectly fine. They just had they had a clutch, and they have all of these hatched out, very successful. That's when they get a little bit immunosuppressed. They may shed the virus, and that's the older birds where there's the problem. The older birds that are breeding that have the young that expose the young to it, and then that's when their young die. And it's interesting with polyoma virus. Usually it starts when you first see it. It's you have like a clutch of three birds, three little babies. Then, you have the most robust, oh man, this one's growing fantastic. It's so big. And look at then you have the little scrawny little thing that's barely making it, but it's still in there, keep going, you're going, the tortoise, and then you have the hare. And then, so which one is affected first? You'd say, oh, well, the little scrawny thing. No. With polyoma, it's the biggest, the most robust, the one that's really going great guns and growing the quickest. That's the one that usually is affected first. Now, in the end, all three will get it, but it goes from the top down. And and it usually presents with uh with these young birds, and it doesn't have to be polyoma, but what happens is that it's this bird, of course, it's the best growing, the fastest and biggest. All of a sudden the food's not going through the crop. You just get this crop stasis, and it's like, well, what's going on? What's going on? And and then you may start to see the bruising because you don't have very many feathers, if any, but and then that's kind of typical. So it kind of with that question, we kind of got into polyoma, and one of the things is that I was talking to Dr. Ritchie, and so they're discontinuing the vaccine. So we're not going to have the polyoma virus vaccine anymore. But I don't know exactly when that's going to be for those, and especially the breeders and on that. So that's just a little bit of tidbit there. All right. There you
Okay.
go. Good
That was-
question. Excellent.
yeah. So I have a question about what is your opinion on spirulina supplement? Does it stimulate fertilization slash breeding in birds?
Oh, that's great. That's a great question, and I don't think that there's any uh, evidence that it does. Um, any evidence based where it does anything. Now, one thing is that I think it's kind of an algae, spirulina, kind of an algae based. I haven't come across it in a while, but as I recall, that's kind of what we're looking at there. I don't think it does any harm. I don't haven't heard anybody, and I know that it's been around for a number of years now, but I don't think anybody's done any study that actually looked at it kind of very strategically and specifically to say, oh, well, these birds had spirulina, these birds did not, and these birds over here, man, and significantly, and they looked at statistics and everything, were more reproductively successful than these over that didn't get it. They got the placebo. So, but it doesn't, I haven't heard it doing any harm, and that anything that you would see um, as it relates to birds, as it relates to parrots, that would be associated with it. I think it would be anecdotal. Somebody said, well, he can say what he wants to. There may not be any evidence-based or scientific stuff out there, but before I started giving this, I was getting nothing. And I started giving it, and now I'm overwhelmed with so many birds. So he can say what he wants to. So good, good. That's great. But
Yeah.
I just there's nothing out there that says it is or isn't. And but I know that it doesn't do any. I haven't heard it doing any um, you know abnormal or bad things. So that's my take on that. So.
Okay. All right.
Yeah, good, good,
Okay.
nice question. I mean, I like that. I mean, it
Yeah.
because this is reality, I mean, we get these questions all the time. I try to do as much investigation as as it is on that. And if I don't know, I'm gonna say you've heard me. I've said you
Yes, you say
stumped the
you'll write it
vet,
down and
man.
look
I
it up.
mean, you got me. But we'll uh, we'll try to find out. And like I said, I learn every day. There you go.
Okay. All right. This is a okay, I think this one has a few questions for you and they're all fascinating. First, okay.
Okay.
We're talking about a 27-year-old African gray lost his bunny friend 5 months ago. That's tender. That he was bonded to for 10 years. So he stopped eating, but is okay now that they got him another bunny, a new bunny 4 months ago. He likes him, but not as bonded to him as his previous bunny. So he's directed all of his attention towards their son. Son and hyper focused on him. Avian visit last week and was given Lupron injection. He's a little better. He had a minor stroke over a year ago and has significant, is it arrhythmia? Arrhythmia. So that's one of that's kind of like a health background. And then they had a question on how many nutriberries should he eat per day? He eats 15 to 20 plus some select human food, but there's a lot of waste. And also, he learned how to snap off the tip of the syringes daily. So they go through four per day, and they want to know if any tape that is bird safe that they can use to tape the tip back on. So,
Oh, okay. Okay. Uh, the I need to get back to, that was good. That was excellent. You did
I also,
good. You did good, but I'm missing a few things here.
okay, I'll fill you in. Just
One was just before the Lupron. What was that? What was that?
um,
There was
the,
something about the sun, the little rabbit.
so it
He
had a
doesn't like the
bunny
little
friend that
rabbit. He
passed away.
directed his attention to the sun.
Yep, hyper
And
focused on him. So the avian visit
the
last week,
bird's micro focused on the sun,
he was given a Lupron injection.
giving him Lupron injections. Yeah, but what are they using the syringes for?
I'm
I
not
mean, because
sure.
I mean, I mean, people out there could go like, "Well, Dr. Tully, you use a syringe to give an injection. Don't you know that?" I do know
Gotcha.
that. But at the same time, they can get the same time they can get the injection, a Lupron injection at the veterinarian's office. And then they have some type of an oral medication that if people with
Oh yeah,
birds know that you can give oral medication with a syringe. And of course, that's when you get the tip near the bird's beak, it can bite it off.
yeah.
That's pretty impressive because some of that plastic is a little pliable and you really need to,
Oh, okay.
you can
That's
bend it.
sorry. It's for clarification. It's for the two heart medications by mouth. That's what the syringe.
Ah,
Sorry, I
yes.
just got that. Yeah. Okay.
Oh,
So
okay.
that's
All
clear.
right. No,
Yeah.
that's good. That's good. Thank you. Thank you. And that does make sense. The and it's probably again small dosages, so you could be looking at maybe uh, uh, a uh, the 1 cc syringe. Now the looking at that, um, I'm still thinking about this bird. Now it had a stroke and it has heart disease. It has
Yeah.
cardiovascular disease.
Yeah.
Yeah. And it had a stroke, but it's
Mini, a
recovered
little one.
a,
Yeah. I mean,
a
like.
little, yeah. Mhm. And so it's recovered from that. And So the only question is about the syringes in the end.
That is one. They also want to know how many nutriberries because they give them
Ah,
15 to 20, but there's a bit of
mhm.
waste because he also gets a little bit of healthy or select human food. So,
Yeah, yeah, yeah. Um, yeah. So they're doing a great job with this. I mean, bird, and you have a fantastic veterinarian. Again, I want to give kudos to the veterinarian for and the veterinary team for taking care of that little bird. But I always want to emphasize it's the owner that does
mhm.
99% of the work, and that's where the as I always say, give credit where credit's due. The owners have to give the medication every day. They're
Yeah.
getting those syringe tips bit off. They're having to catch the bird. They'll all do all of this. So it's a team effort, but the majority of the work is with the owner, and I want to commend them for doing that. That's really great because you're doing a great job on this and running into a problem. Now, let's start with the syringes. Now, you need to have the syringe to give the medication. It is possibly uh, a small amount of medication that you have to give. So we're looking at, in general, you can go from like tuberculin syringes to 1 cc syringes, 1 mil syringe to 3 mil syringe to 6 mil syringe. So I don't think, and hopefully you're not giving over 1 mil of 1 milliliter of medication per medication. Uh, Most of these you don't want to mix like this. I'd have to ask a pharmacist if you would mix. I don't know if you have a Suck Supreme or if you have some other pimabendin. I'm not sure exactly what you may be given for heart medication, but as long as it's a small, um, amount, I would say, like I said, less than a mil. But as far as mixing them, because sometimes if you mix it and you only have to give it once, it does make it a little bit less. And of course, you'd have fewer tips bit off. Now, what happens is that, um, you know, if it is one cc syringe, so you could cut the tip off before it bites it off. And when you're saying bite it off, I'm sure that it's chewed or bent or what have you, where it's
Mm.
just not cleanly bit off. I mean, that's what you're picturing. It bit it off like, whoop, it's gone. So I don't think it's that. It's kind of like, oh man, it's just all mangled at the end. Just kind of gnawing at it as we call it.
They pick it up and they're
Yeah, 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 yeah. Yeah. You can see it. But so the problem is that that's not it's going to be difficult. It's always better if you can get it toward the side of the beak because it's not as I guess agile at the side of the beak as it is in the front. Also, kind of the tip, if you, yeah, it's like you could cut off a 1 cc at the tip of the 1 cc syringe and just have the barrel and draw up as much as you need just in the barrel. You won't have the tip, but it's just a round barrel and you can do that. Um, and that may be a little bit give you a little bit more give to it and not crush if you just had the barrel and just cut off the tip and so it's just round and then you just have the barrel on that so I can draw that
okay.
you have a regular syringe and it's a small 1 cc syringe and so you have the syringe here. And so you have the on the end here. Can you see that? Yeah. And so
Hmm.
you have the syringe here. It's a 1 cc syringe, and then you have the what we call the kind of the tip, and then the needle fits on that, right? So the needle will fit on that, and so that's where the needle goes. But so the needle's on that. So what you do is you just cut that off, and then you have just the round part here. Okay. And so you cut that off there, but it's still just the tip because all of the increments are the same. It's all the same. And just because it's more round here, you can squeeze it and it'll kind of go back to its normal level. So you may get a little bit more use on it, but also on the side of the beak, if you can do it on the side of the beak, that's going to help and kind of drip it down on the side but if you get it up here, oh, well, you know the rest of that story. So, um, that's the syringe situation. Now, and remember, that's great that you're treating it, because that's the first thing. If you can't treat the animal with the prescribed medication, it will never get better. Okay. If you can't treat it, you can say, well, look, I've treated them before, and you get to a bird that you have that there's no way I can treat it. Please let the veterinarian know. Can't treat it. You got to figure out how we're going to need to do this without me catching it and putting medication in its mouth or what have you. Um, whether it's just the bird gets too stressed, or you can't, you don't have any help, or all different types of reasons. Please just say, hey, look, can't do it. And don't even try. I've had owners come back looking worse than the bird within 2 or 3 days, because they just said, can't do it. Or, coming back in and it's not getting any better, but well, you're supposed to give, uh, you know, 8/10 of a cc. Well, got a little bit here, spit some out. He's getting something,
Yeah.
and it's not getting better. And so just remember, it's not going to get better or giving us the best chance of it getting better if that medication is not administered properly in the right amount, because it's calculated to do its job. And that's very important. And that's why, you know, the bird owner has the most, gets the most credit,
Mm.
because that's who is going to be treating the bird there. Now we get to nutriberries, right? How many
Yeah, it's the next
nutriberries?
one.
Well, Dr. Lafeber would kick me from here to California, from Louisiana to California, if I didn't say nutriberries. You know what I'm going to say, I think, Laura. Nutriberries are,
Just say
can
it.
be provided as a standalone diet. They are not,
Yep.
they're not developed as treats, you know. And so you could feed the bird, and that's what Dr. Lefebvre will tell you, and he's told me. And so, again, the Nutriberry could be their sole diet. Okay, there you go. That's how many. And so from from however many you want to feed to that's all I feed them. Then there you go. That would be acceptable, and that is I'm going to go out on a limb here and say I got Dr. Ted Lefebvre's stamp of approval with that answer, because that's how it was uh, actually. Um, you know, I've
I think it's
involved in
because
talking.
birds eat them so readily that people assume they're a treat because the
Yeah,
pellets stick to
exactly,
them. Like that's
exactly.
how they got. Yeah.
Exactly. And that's the thing. And the pellet berries and different things if you want more pellets and but yeah, you are correct, Laura. It's kind of got, well, they like them so much it can't be a regular diet, right?
Yeah. Yeah.
But it's kind of a diversified foraging diet that is nutritionally complete as solo standalone diet. Yeah. So there you go.
I was going to ask you about the meds just real quick. Are they, because the only meds I've ever had prescribed for my birds are prescribed were syringe. Are there any other, like, is it always going to be a syringe? Is it ever going to be like a pill form or a dip in the water? Is it always going to be a syringe? Because
Oh
some birds,
yeah,
it's like trying to do an alligator or a dinosaur.
I just prescribed tablets today for a macaw. And,
Oh, okay.
uh, but guess what?
Didn't like tablet.
A capsule tablets, you got to crush it up and put it in some kind of you know, um,
Food.
like some kind of vehicle, so that it can be administered. You could put it in some type of, I'm just using this, just to give you an idea of the kind of the substance, some type of a pudding or some kind of I'm not saying chocolate pudding or what have you, but some kind of a natural fruit, applesauce or something like that, and try to administer in that. But it would taint it. I would think if you crushed up or put a capsule in, that you would still taste it in that, but maybe not enough. There's different ways and that's a good question. I remember, there's medication. Dr. Flammer from North Carolina State, fantastic veterinarian, avian veterinarian, developed a way to put medication on seed on for doxycycline on seed, and he has a recipe for that for to treat birds. You can do that, and of course you can put it in the water. There's some water soluble medications, and we use that for years. There's there's some long acting injectable drugs, so we don't have to uh,
Mm.
give the medication every day. You may come in once every 3 days, once every 7 days for an injection, and you could have two injections and cover 14 days, you know. And so this is for us as far as veterinarians and trying to prescribe medication. It's a multifaceted. It's just not like, oh well, we're just going to go ahead and we everything's on the table, for us as far as antibiotic administration, because we have everything from parrots to hyacinth macaws, and you're looking at trying to get medication in it. You have everything from the bird that's going to sit back and go, feed me, to the one that, if you look at it, it's going to rip your head off, And so you have all of these varying variations, and so we have to think of what's going to give us our best chance of resolving whatever's going on, and if we're talking about an infection or heart medication, that's very important. How can we get that, and we have the owner where they can administer that to actually have some have a treatment response, and it is a challenge
Mm.
for us to be able to do that. And so we look for all different opportunities and options of that. we don't want to fool ourselves either. I mean, you look at, well, I'm gonna, something that we can inject medication into a grape and feed it to a toucan or something, where it's just like boom, it grabs it in the air and then puffs it up and swallows it whole, right? That's great. But if that toucan would bite into it one time and taste it, that would be the last time. You see what I'm saying? I mean,
Yeah.
so it depends on what kind of bird you're treating to what type of uh, what you can use. And so it is quite a challenge. And that's how one question about tips on syringes kind of leads you into
Yeah, this
expanding the whole range of just treating birds and the difficulties and how important it is. Because like I said, you have to get that medication in or
yeah.
it's not going to work.
Yeah.
Yeah. So anyway, good. Thank you. That's
If someone
great.
could start a mobile like vet tech mobile service where they can just, for dogs, cat, birds, all those pets that just don't want to take their meds, they could just
Yeah.
that's
Oh, yeah.
a business model right there. All right, a question. Okay, about chicken egg. So chicken eggs. What is the difference between a washed egg and unwashed egg in terms of freshness? Should the egg be kept unwashed to stay fresh longer? And how long until the egg becomes rotten? Should the egg be kept unwashed or washed in the refrigerator or outside? So we're talking chicken eggs, freshness.
I am not necessarily a chicken egg. Um, I don't know. Anything that I would be is my opinion, and I would think if you're looking at trying to maintain freshness and want as much sanitation as possible, then that is um, that is something that you need to do some research on that. I can tell you that the eggs that you buy in the store and have bought in the store since day one of your lifetime or recent since the middle of last century are washed.
Hmm.
They're washed. You don't see poop on it. You don't see dirt, and if unless they're, something from a local, somebody who just puts them in there and gives them to you. You may see some cracked eggs. You may see one that missed inspection or what have you, where it was, uh, you know, but for those are washed and cleaned, uh, and they go through a process um, on that. So that's just the commercial eggs. Okay. Now the thing about washing and what you're going to have to look at, those shells are porous.
Hmm.
They're porous. They have that's important that they have holes in them, or if they were fertile. But uh, these aren't what you're looking at fertile, and so the porous nature of that eggshell, it depends on temperature and how much what you wash them with. If because the temperature gradient can actually pull microorganisms into the egg when you wash it, and instead of leaving keeping and just washing outside instead of drawing them in due to the temperature gradient. So that's what you need to look at, and why washing is just not washing. You have to do it the right, do it the correct way, to decrease the chances of having any contamination within the egg when you wash it. But no, uh, I would say personally, I would want my eggs washed, just due to just the contamination. If you don't wash them and you're cooking and and you have to break the eggs open. Well, it's all over your hands, it's all over the place, and so that would just be my own personal. Uh, I wouldn't want to, have an unwashed egg. But good question. We'll
Yeah.
take it. But look into that a little bit more on the proper temperature and how that should be done and when it should be. And I'm sure that that's all out there. Hmm.
I do the old test where you drop it in a like a bowl of cold water. If it floats to the top, it's bad, and it's
Oh, if it's bad. Oh,
or
if
if it
it's
starts going. I
well, I'm only
yeah.
talking about good eggs here,
I
Laura.
mean, if you're like the date, the sell by date, like oh,
Yeah.
so far I'm still doing okay. That's how I do it.
Yeah. Well, that's good. That's good. Excellent.
Or I built my immune system up. I'm doing no.
Uh,
If anyone has any tips for how to test for fresh eggs, put it in the chat.
mm,
Um,
yeah. Yes. Yes.
all right, so I got wow, okay. I think that's enough for our questions. So those are fascinating. We got some I love these like never thought of these questions before. These are amazing.
No, no. I mean, we had, a great great
So
group today.
today's theme I think had a lot to do with I mean, and it's a very important and one that we've never like is getting medications in the birds because you're sent home with the marching orders and then to actually execute those orders at home is another thing.
Well,
So
it is, and then and and that's the same thing we have, when we go to like conferences or what have you, and they say, well, we've got this new technique, or we've done this is what you should do, right?
yeah.
And so and here's somebody promoting it, and so you gotta, and then you look at it and you go like, you get back and you go like, whatever it is, it's a procedure, it's something, and you're going like a surgical thing or whatever, and you go like, what's wrong with me? You know, this is
Yeah.
like totally like, how in the world can you do this? I wonder if the guy, the whoever was presenting this had ever done it themselves. You know what I'm saying? It's just like, I'm thinking that when I'm prescribing, like I've said before, that's me. And I know what it is like to treat birds. I've treated a number of birds over the years. But and I know what it is like on the other side, where I've had to, like, well, some of the people that are treating birds have never treated a bird or ever caught a bird or what have you, and before. So that's like me. Well, I've treated cats, but I've treated my own cats, you know?
Yeah.
And so that's what I try to think about when I'm prescribing medication. And I'm sending, and that's why I say, let me know, is this possible? Can you do it? If not, we'll have to try to figure out another way. But, it's not one of your marching orders. Yeah, it's not, it's one of those things that veterinarians, need to think about. Like, hey, look, you, s- you know, think about what you're prescribing and think about how possible that is. Because just because you prescribe it, doesn't mean that, that owner is going to be able to do it. And so, but yeah, and that's something, that whole area that was, I don't think we've really touched on that as much in the past. And but as you can see, it's one of the most important things that we have to do.
Yeah. Okay, I'm gonna oh just a fun announcement that Lisa, our own Lisa Bono, she is at the National Bird Show in Knoxville, Tennessee tomorrow. So if you're in the area,
Yeah, in
go by and say
Knoxville.
hi to her. Yeah, uh,
Smoky Mountains. There you go. Smoky
there you
Mountain
go.
National Park. There you go. Dollywood. Great raptor show at Dollywood. I
Oh, okay.
definitely recommend anybody that goes up toward Gatlinburg, Pigeon Forge, go see that raptor show. That is
Okay.
fantastic. There they had a eagle refuge on the side of the mountain right there. A lot of bald eagles. So
Oh, wow.
There you
Okay.
go.
Another
For
reason to go.
Eagle and
Go.
Tuna,
Let's
and
go.
go see Lisa if you're in the area tomorrow. Yeah, very
All
good.
right. All right. Let's see. Speaking of Lisa, just to give a heads up, as we march towards December, it's so close. We're doing our Fun for the Holidays annual Pet Bird Holiday Gift Guide and giveaway on December 19th, and that's going to start an hour earlier than usual. So mark your calendars now and join us. We're gonna have some wonder. I mean, if you've ever been to our holiday thing, we get some really good giveaways. And then next Friday we will be on with Dr. Lamb. I'm sorry, not next Friday. Sorry. December 5th. Sorry. We have Thanksgiving next week. Forgot. December 5th. We'll be on with Dr. Lamb
That's Black Friday. Black Friday, everybody.
on Black Friday. Yeah. We're gonna divert your no, on December 5th, the Friday, December 5th, we'll be on for iron storage disease. And just to give you a heads up, Dr. Lamb's webinar is when the time changes. She's an hour earlier than usual. So there you go. Today's giveaway winner, gotta get to that. That is, oh gosh, where did it go? It's gonna, of course, be Dr. Tully's favorite product, Live Late, because you guessed this on our previous webinar, what our special product
Pumpkin
reveal.
spice,
Pumpkin
right?
spice Nutriberries,
Yes,
yes.
indeed. You got it. I mean, it's very nice. I mean, the Pilgrims would have loved it for
That's
their
right.
birds, and so that's great. That's
That's
great.
gonna go out to Jay Bruno. Congratulations. And you also get to choose another
All right.
lovely product of your bird's choosing. So yeah, just in time for Thanksgiving, some pumpkin spice Nutriberries going out to you. And also a reminder, I think those are limited edition. So if you're gonna order some pumpkin spice, I would do it sooner than later. So make sure you
Yeah.
stock up on it. On that note, let's just wish everybody wonderful Thanksgiving, right? So we'll be on after that. Close out
Yes.
December.
Yes. Enjoy. Enjoy, and thank you. And we have a lot to be thankful for. Thankful for our attendees, Laura, Brenda, Lafeber. Thank you, and look forward to seeing you next time.
All right. All right. On that note, guys, everyone have a fabulous weekend. All the best to you and your flock. Till next time. Bye.
All right. Bye.